Rectal route. As we all know that the rectal route is the route of administration of the drugs in which we administer the drug through the rectum, which is then absorbed by the rectum blood vessels. So we see the advantages of the rectal route and disadvantages of the rectal route. First of all, we see the advantages of rectal route. We see the most possible advantages of rectal route. The rectal route can be used when oral administration is impractical, like when the patient is unconscious or the patient is in coma. Secondly, the rectal route is used when the drug is highly irritant. Then we prefer the rectal route. When the patient is in the vomiting state and we cannot use the oral route, then we also use the rectal route. And in the rectal route, there is less enterohepatic metabolism. About 50% drug will bypass the liver. And drug administered rectally have more rapid absorption as compared to the oral administration. And sometimes we require the local actions in the rectum or the lower gastrointestinal tract. Then we give the drug through the rectal route. So that's most possible advantages of rectal route. Let's move toward the disadvantages of the rectal route. First of all, the rectal route is imperfect and incomplete absorption. It have more rapid absorption than the oral route, but it have imperfect and incomplete absorption. The second is rectal inflammation can occur when we give the drug through the rectum. So there's most possible chances of the inflammation. Third, patient may feel uncomfortable. Some rectally administered drug may cause the irritation in the rectum that may lead to the resistance or non-compliance of the patients.